They ended at adulthood, you couldn't be more wrong. Dermatologist Dr. Howard Brooks joins us with what you can do. And good to have you back here. And I would say this is not fair. With puberty, you expect to have some pimples, maybe even a bad case of acne. Right. But you grew out of that. You shouldn't have acne as an adult.
That's true. That's what everyone thinks.
Right.
And people are so surprised when they come in and say, what's going on? And I expect this. I'm going to my prom. I don't expect it now when I'm in my 20s and when I'm in my 30s.
Is this the same acne that a teenager has, or is there something different about what happens in an adult?
Usually it's one of two things. It can be completely different, something called acne rosacea, but it can be a continuation. Approximately 25% of adult men have acne, and approximately 50%, unfortunately, of adult women have acne.
Of course, women would be bothered with this. We have some pictures that we're going to show you, and this is just how serious we're talking about. We're not talking about a little outbreak.
Right. It can be very serious, and this is very disheartening for patients when they come in, but there is hope out there, so that's the good thing. We tell patients to, first you can try some over-the-counter products. You want to look for products that contain benzoyl peroxide, salicylic acid. Even to be honest with you, Proactive can work. It contains benzoyl peroxide, absolutely.
So those commercials and what we hear from Jessica Simpson and Vanessa Williams, they probably
do work. They probably do work. Now, I want to tell patients to, try them for at least 4 to 6 weeks. If you don't have success with them, then that's when you want to come in and see a dermatologist.
Now, this is also, it has nothing to do with hygiene. That was the one thing we always said, make sure you get all of the makeup off and you keep your face clean. This, again, has nothing to do with that?
Well, you do want to make sure that your face is clean. Now, it is a misconception of, things you eat. People come in all the time, well, I eat fried foods, I might eat chocolate or drink soda. That really does not play a role in it, but certainly you want to wash the makeup off.
You were talking about the different kind of products you can get. Are they all you can do over the counter, but some of the serious pictures that we saw, do you have to see a dermatologist?
Well, those pictures that we showed, absolutely. I think that's where you do want to come in and see a dermatologist. There's a lot of different products that we can use, oral medications, topical medications, and even sometimes, again, here's a case where I don't really think that he's going to have success with over-the-counter products. He would probably want to come in and see a dermatologist.
Any consequences to some of the medications? Because we've heard some of the horror stories about teenagers on Accutane, I believe it is, and then having suicidal tendencies.
Right. I do think Accutane gets a little bit of a bad rap around here. Certainly you do have to watch out for liver tests, your pregnancy, and different things, but I think Accutane gets a bad rap. Overall, most acne medications, what you find over the counter, and even what I would prescribe, can lead to dryness, a little bit of irritation, and unfortunately this is disheartening not only for teenagers but for adults, myself included, that acne can get worse at first.
Wow.
Yeah, so it can bring out the acne for the first week or maybe 2 weeks.
One of the other controversial treatments of acne in adults is the use of the birth control. Is that something doctors still have as part of their tools?
We do. Now it depends, of course, on the patient, their history, how their acne presents. If a woman comes in and tells me that their acne is really bad around the cycle, then that would be an option. Absolutely.
Okay. All right. And then for those serious scarrings, you can help them overcome that or minimize the look and appearance of
Absolutely. I think that's, and what's so exciting about today is that there's so many, we can treat all skin types, from the palest to the darkest. And before, a lot of patients still have the misconception, if you're a person of color, there's nothing I can do. But there are certainly a lot of things we can do now.
Dr. Brooks, good to hear that.
Thank you.
And thank you for being here with us.